Dear colleagues, following the outcome of my preceding presentation, I will just try to introduce you into a specific example, illustration the role and impact of biodesign in prompting personalized and precision cardiology to get it advanced. I'm not familiar and move this might be reduced. There you go. Oh, thank you. So thank you. Autoimmune responses resemble normal immune responses to pathogens, as specifically activated by cell antigens or autoantigens, and give rise to autoreactive effector cells and to autoantibodies against the self-antigens. When the reactions to self-tissues do occur, and are then improperly regulated, they cause a variety of chronic syndromes called autoimmune diseases. Okay. Meanwhile, autoimmune myocarditis can be defined as the inflammatory process affecting the muscular tissues of the myocardium of the heart. Just illustration of the latter mentioned. And then is being transformed in a stepwise manner into dilated cardiomyopathy. Myocarditis is considered an important cause of sudden death, as has been shown by autopsy-based studies in the general population. Regardless of its etiology, the acute inflammation may progress to subacute and chronic stages and finally to tissue remodeling, fibrosis and loss of myocardial architecture and contractile functions. The latter in a process of chronic damage corresponds to development of dilated cardiomyopathy. New targeted therapies for autoimmune and inflammatory diseases would require greater understanding of a patient or a pre-illness person at risk. In this sense, the identification and implementation of diagnostic, predictive, prognostic biomarkers look the scope of the latter. Remains the holy grail of all the platforms and algorithms. Biomarkers enable pre-early, including subclinical diagnosis, guide targeted therapy, and monitor the activity and therapeutic responses across the diseases. Biomarkers, next step generation. Accurate prediction. Accurate prediction is crucially vital for prevention of autoaggression, not for canonical treatment, for prevention. And the targeted treatment could thus be given to those individuals who are most likely to develop the disease. A grand role in the development of autoimmunity in autoimmune myocarditis is the exposure of self-antigens which are encrypted and unavailable to the immune system under physiological conditions. Cardiac myosin, CM, is one of the most important self-targets in AIM. Just the illustration of the letter. The latest concept demonstrate that the anti-CM autoantibodies play a significant role in the development of cardiac autoimmunity. The primary damage in AIM progression and evolution, which is mediated on anti-CM autoantibodies to trigger a release of separate but pathogenically valuable cardiac-associated epitopes into the bloodstream. Those epitopes act as powerful sensitizing factors to generate autoantibodies more and more, which in turn would drive the autoaggression and thus the disease progression. At present, a broad spectrum of cardiac-associated autoantibodies occurring in AIM patients has been confirmed to be very large. Several groups have shown that the subset of patients with AIM and their symptom-free relatives has circulating heart-reactive autoantibodies. Those antibodies are directed against multiple antigens, some of which are strictly expressed in the myocardium. Others are expressed in heart and skeletal. I would try to reduce. The unique clinical case is a family of antibody proteases, which are already mentioned in the previous speech, detectable in AIM to cleave cardiomyosin. Antibody proteases. It's just the protocol for identification. The activity of antibody proteases markedly differs between AIM patients on the bottom and healthy control. Of greater interest is the evolution of antibody-associated natural proteolytic activity at different stages of the disease progression. For those purposes, we have been monitoring AM patients, their direct relatives, and healthy controls for 2-3 years each. Look. Activity. Presence in cases. AIM patients. Relatives. Healthy controls. Drastic difference. But just keep in mind that there is drastic difference between relatives and healthy controls too. As it's broadly known, canonical autoantibodies play neither predictive nor discriminative role to affect the subclinical stages of AIM IM. In contrast, antibody proteases with the targeted functionality have proved to be greatly informative and thus valuable biomarkers to monitor AIM at both clinical and subclinical stages. The translational potential in the rational design of new diagnostic tools and new therapeutics. In this sense, targeted antibody proteases can be programmed and reprogrammed to suit the requested standards of regeneration. So, antibody protease engineering would offer the ability to enhance or alter their sequence-specific activity to expand the clinical utility of the absolutely new tools. We have just signed the pre-contract agreement. I have known just an hour ago with two companies, one from US, the second one from Japan. The first company on making the rational design for antibody proteases, the second company for implementation, for making the impact for clinical utility to be used further for application for FDA for 3 years each. That's for me unexpected so fast. Thank you so much.